Hello, Dr. Samuel. Hello.
Good morning. Good morning from Cairo and to you in Beirut. So Dr. Maha Hoteit is the coordinator of the Food Science Unit at the National Council for Scientific Research in the Republic of Lebanon. We're very happy to have you as part of the expert group joining G-Force on this particular topic of food consumption data. And Maha, you have prepared for us a presentation to review the methodologies for food consumption data collection. So take us a little bit back, but with an application that will be dedicated to the Arab region, given also that as an organization, we have an involvement in the Arab region and we are working towards creating a collaborative mechanisms to support the collection of food consumption data for the purposes of exposure assessment in the region. So Maha, I'm going to give you the floor and thank you for being with us once again.
Thank you again for providing me this opportunity to present today the methodologies for food consumption data collection and the application to the Arab region. We know very well that ensuring the timely and precise attainment of the global nutrition targets and sustainable developmental goals is vital for advancing both national and global development, with particular emphasis on the level of health and well-being and the prevention of chronic disease. And the food consumption surveys play an important role in mapping the food and the nutrition data of nations and translate them into actions or actionable food and nutrition strategies and policies. So as outlined, after listing the main outcomes of the webinar, I will discuss the dietary assessment methods briefly used in food consumption surveys. Then I will be focusing on the individual food consumption survey that was one of the main important topics in G-Force review paper for planning to the first food consumption survey. At the end, I will present an example of national food consumption survey that was conducted in Lebanon. So, as said before, food consumption survey estimate the consumption of foods and nutrients among specific target populations within defined region. And usually the food consumption survey are initiated by governmental entities on a nationally representative samples with the three primary objectives. The first one is to identify deficiencies or surplus in nutrients. Two, assessing the adherence and the compliance with dietary recommendations. And three, for sure, evaluating risks related to food safety, including potential exposures to contaminants. So the main outcomes of this webinar are answering these questions: which method and tool were used previously in the food consumption surveys in other countries? The second question, which method and tools are available and can be used at Arab level for developing the Arab food consumption surveys? And finally, which lessons can be learned and recommendations can be given for an update of the guidance for collection of the data in the Arab countries? To ensure that the food consumption data is suitable for exposure assessment to chemical substances and biological agents, there is a need for recommendations on age-appropriate food consumption data collection methods, and also on the description of foods and on the quality controls used through the dietary surveys, among others needs. So in order to assess this issue and to increase the quality of the food consumption data, the European Food Safety Authority developed the EFSA guidance on the EU menu methodology. And according to this guidance, developing consumption survey will require that we need to prepare for preliminary study plan. We need to evaluate the availability of acceptable methodologies and tools to be used. We need to prepare for a detailed study plan and related documentation. The evaluation of the study plan requirement along with estimation of the budget are very important before having the approval process for the study plan and the budget, and finally, the compilation of implementation plan. So starting by the first battery assessment method, which is the food balance sheet, which also referred to as national food accounts or supply accounts or utilization accounts, or even food disappearance data or food consumption levels estimates are developed by the FAO in conjunction with the National Statistics Office, and they are commonly used to estimate the food supply and its utilization at the national level. Usually the foods tracked through the FBS include wheat, rice, fruit, and vegetables, and also a number of processed commodities. And the most important thing that the food balance sheet data present comprehensive picture of the pattern of the country's food supply and show the sources of supply and utilization for each food item. So the equation is that we need to add the starting stocks plus the quantity imported plus quantity produced minus quantity exported plus seed plus animal feed plus waste plus other non-food uses minus index stocks. So as we can see that the FBS report food available for consumption at the aggregate or national level, but do not directly measure food consumption but by households or individual. Therefore, the FBS data sometimes cannot be disaggregated to determine the distribution of food consumption, also seasonally or even by demographic characteristic. In addition, the data on non-commercial food production and detailed information on processed foods are not available. And also, fewer than 100 foods are accounted for in FBS, limiting the level of details. So given the limited level of specificity of food in FBS, sometimes it can be difficult to match these food items with food composition databases per countries in order to calculate, for example, nutrient availability in the food supply. The good news that the FAO provides information now on per capita energy, protein, fat, and carbs by matching data to food composition databases. And also several efforts have been made to match FBS to energy, macronutrient, and full range of vitamin and minerals. And despite some of the limitation, one of their key strengths is that they are free, they are available data sources, and provide publicly proxy information on the trends of population level consumption patterns, which is based on food available for consumption in food supply. Moving to the next one, which is the household consumption and expenditure surveys, which is referred also to be nominated as a household income and expenditure survey or household budget surveys. Usually, these are kind of complex surveys conducted on nationally representative sample to characterize important aspects of household socioeconomic condition. Typically, they are conducted every 3 to 5 years in a range of countries that cover 7,000 to 20,000 households to provide a statistically representative data. This is very important. And also, most of these surveys are implemented by national statistical agencies, usually supported by the World Bank. And the results of these surveys have wide-ranging utility. Their primary purpose is to provide information for poverty monitoring, for calculation of national accounts, for input for consumer price also. And there is increasing interest today to use these surveys for the food security, for information on food security and nutrition. And we have, so the benefits is based on the research, existing research, there is wide consensus that these data are carefully designed to have information or data for household level food security and nutrition measurement. But one of the major drawbacks is that the consumption modules are heterogeneous across countries. which means that not all these surveys data lend themselves to the same food security and nutrition analysis. And comparison across country can be sometimes inaccurate. And also, these surveys do not capture seasonal variation. And the length of the recall period ranging from 1 day to 365 days. It's a long recall period, where also data are collected for acquisition or consumption or both. Some of the food or some of the information are related to food acquisition, purchases only, or own production. Or also whether or not information on food consumed away from home is collected or not. And while the abbreviation C in HCES stands for consumption, the HCES collect data on acquisition, as already said, but it typically refers to apparent consumption, and it's completely different than the actual consumption. And usually acquisition data serve as proxy for food consumption, as household may build food stock or consume food stock during the reference period. This is important point because some foods, for example, grains, are not perishable and can be stored. Therefore, some households may be drawing down stocks acquired to meet current consumption, while other households may be accumulating stocks that will be consumed after that period. So compared with household consumption and expenditure survey method, the individual food consumption survey methods yield more reliable measure of dietary adequacy and exposure to contaminant at individual and also at household level, because it's based on actual food consumption rather than food acquisition. According to most of the research, it's the gold standard method. Further, since the data are collected at individual level, the comparison can be made across age and sex groups, and even the inequalities in intra-household food distribution can be identified. According to the FAO and WHO, there are main individual-based methods for food consumption survey grouped under current dietary intake and past dietary intake. We know the 24-hour dietary recall, the estimated food record, the weighted food record, and the past dietary intake method, food frequency questionnaire, or diet history. To start by the 24-hour dietary recall, it consists of listing food consumed during the previous day or during the 24-hour prior to the recall interview. And these surveys generally collect information not only about the type and amount of food consumed, but also the source of the food and the time of day when and where the foods were consumed. Researchers have developed kind of multi-pass method. It's called 24-hour multi-pass method that guide the respondent through the 24-hour reference period several times, providing opportunity for the respondent to remember food details and additional food, because some of the limit that people sometimes they cannot recall what they eat in the 24-hour prior to the data collection. So the other one is the food record or food diary, which require that the subject report all food consumed during a specified period, which is 3 to 5 days. And these surveys collect information not only about the type of food consumed, but also the source of the food consumed, and the amount sometimes can be measured accurately. That's why it's the name is for the second one is weighted food record. Both food records types need a high degree of response, cooperation, high level of literacy, and also the weighted one is sometimes expensive. Moving to the food frequency questionnaire, sometimes it's called list-based diet history, which consists of a structured listing of individual food or food groups, and for each item of the food list, the respondent is asked to estimate the number of times the food is usually consumed per day, per week, per month, or even per year. And the food frequency questionnaire may be unquantified or semi-quantified or completely quantified. But in our case, the unquantified questionnaire does not specify serving sizes. That's why we cannot use it. We prefer to use the semi-quantified tool that provide typical serving sizes. And we know that some food frequency questionnaire include also questions regarding the usual food preparation method, the trimming of meats, use of dietary supplements, etc. So we can use this kind of food frequency also when needed. Also, we have other tools that or databases that are needed. For example, the food composition databases, the recipes, the food list, the food descriptors, and we need also, before starting to work on the field, to classify the foods, to do the food classification according to food groups. We know very well also concerning the interview method that surveys can be presented to participants in a variety of ways. And this include two types: in-person, face-to-face method, and the at-distance method. And these are divided into four: the pen and paper personal interview, the computer-assisted personal interview, and the computer-assisted telephone interview, and the web one. So the best one is for sure to be directly in interview with the person or the participant, and the best one for sure, the pen and paper personal interview. And sometimes because of the technology nowadays, computer-assisted personal interview is also recommended. Moving to the application in the Arab region to implementing an Arab food consumption survey. We know the situation now in the Arab countries. The Arab countries are suffering from double burden of malnutrition and non-communicable disease, in which undernutrition coexists with rising rate of overweight and obesity. And as you can see in these figures, malnutrition among under 5 children exceeds the global rate, specifically for wasting. This is a form of malnutrition. And the prevalence of overweight and obesity increased in the region compared to 20 years ago. This is an issue for the Arab children and also for adolescents and adults. And not only that, pregnant women are also affected by anemia, which raised the prevalence of low birth weight in this region. That's why it's very important to explore real food consumption of the Arab population to investigate their adherence to the international guidelines. Concerning food consumption data in the region, and after skimming the literature, we found that 96% of the Arab countries have no updated food consumption data. All the countries on the map conducted surveys, yes, but they are old, since 5 years or 20 years ago. To assist the Arab countries in updating its data, G-Force prepared a roadmap that will be published as a review paper, where it will explain in details all the steps required to accomplish the objective of developing the Arab food consumption survey that will be launched very soon and conducted in 22 Arab countries. All the methodologies listed previously will be considered during this project, during the conduct of the study, taking into consideration that we have to use the 24-hour recall, the food frequency questionnaire, the food propensity questionnaire. Also, we'll be using some available software to analyze dietary data and the collected information that will be linked to the food composition tables in each country. And I would like to share with you that we have now at the Arab level a common Arab food composition platform called Eastern Mediterranean Region Food Information Data Bank, or AMFID. So as food classification, both GEMS or EFSA or any other classification can be used. In addition, food lists and recipes adapted to the Arabic cuisine will be used. And it's very important to highlight that any tools or instrument that will be used during the data collection should be validated in the country itself. This helps in representing the culture and the food consumed by the population per each country. The good news that we have valid food frequencies in these countries: Saudi Arabia, Qatar, Kuwait, Bahrain, Lebanon, and Palestine. And we have food composition tables also adapted to each of the countries in the map: Tunisia, Sudan, Egypt, Palestine, Lebanon, Jordan, etc. So this is an example, for example, of the Lebanese one, the most updated Lebanese food composition data that will be used and was used also by our research group in Lebanon. As discussed before, concerning food recipes and standard cooking technique, also these information are very important, and these databases are also available in the Arab countries. And we also developed an example in Lebanon showing the Lebanese food exchange system that will define the serving sizes for each food consumed. As for the classification, it's very important before starting the survey to select based on what the food groups will be classified, and to identify food descriptors, and also what are the food lists that will be used in the questions. To conclude and to finalize with recommendations, conducting the food consumption survey starts by setting objectives and outcomes, then drafting proposal, calculating sample size, selecting which methodology is most suitable, preparing the questionnaire, the budget, and also showing or preparing the statistics plan. Moreover, partnership is very important in this kind of surveys, and the preparation of ethical approval should be also ready on the table before moving to do training and starting the field work. And during implementation, many steps should be taken into consideration, mainly the provision of transportation, the data entry, and data collection and equipment and documentation. So at the end, we recommend that all major food groups should be represented, mainly processed food, mainly the food that are fortified, and we should adapt our food list before starting to the national food consumption tables, and to select which classification we should follow or adopt before the field work. And finally, to consider also seasonality, because the quantities, because the prices, because the dietary patterns can be modified with seasons. Finally, this slide shows the effort of the Lebanese group, research group, where we conducted an updated national food consumption data on 2,940 participants, where we used all the tools already discussed in this webinar, and we are looking forward to publish this data and present it in 2024. Thank you so much.
Thank you very much, Maha, for this great overview and really for reviewing the various approaches, for discussing their pros, their cons, as Dr. Moaz was indicating, also the feasibility. I mean, we understand again that when we look at what we want to achieve, which is again trying to have the best representation possible of the dietary patterns, so the consumption information for a given population, while we want to achieve individual food consumption surveys, which is again the gold standard, as you indicated, in the way we ought to collect data, when we look at that, sometimes the task may appear daunting because again, you've identified the number of steps that we have to follow. You've identified also some prerequisites, being able to have food composition databases, being able to have a good descriptor of the recipes, being able to have and to rely upon a food classification system according to which the data will be recorded. So again, the task may appear daunting, but at the same time, you've also indicated that a number of countries have done quite a bit of investment in this area. And we know that there is a possibility to leverage the efforts, leverage the investments that have been made in one area and another. If we take the example of the Arab region, I think that's probably a great example. From a regional standpoint or a sub-regional standpoint, there might be opportunities to leverage each other investments. And again, even though the plan is still to work towards getting individual food consumption data for each country, I think collaborations between countries and working also on a regional approach may offer opportunities to address, I guess, the level of investment that needs to be faced. I'm just looking at our number of participants. I think so far we have had basically between 110, 120 participants if we count colleagues that have joined us on Zoom and others that are following on YouTube. We've looked at the questions and the comments in the chat. I don't believe that we have had questions. We have had some comments, mostly on availability of resources in other countries. Dr. Mahmoud Amara, I think from Egypt, is mentioning some availability of resources that are made available in Egypt. There was a question about the presentations. The presentations will be made available to you. We will be making available all the presentations ready to download on the G-Force website in the events section. So essentially where you got the information about this event, you will be able to download the presentations. So we'll make them available shortly after the event itself. Now I'm gonna turn back to Dr. Muaz and basically ask you about your perspective, your advice on where we need to go if we are to address this data gap, this important data gap of food consumption. And what would be your advice, your direction from WHO, but also from a practical standpoint?
Okay. Thank you, Dr. Samar. But let me first recall something important, that the important role of consumption data in risk assessment related to possible hazards in food. Such data are very important to assess the consumer exposure to such hazards. Not only to assess the exposure to hazards, but as well the possibility to estimate the intakes of nutrients. So those databases are very important for both food safety and nutrition. So this is very important for one of your questions, how to organize such very complicated and sophisticated survey. Second, now, what the gold standard is known. You need to have individual data. Individual data are very important at different steps of risk assessment. Of course, when you don't have individual data, you can use surrogate data. The budget methods can be used. I don't say are not useful, are very useful. But we need to use the STEER approach because the problems are becoming more and more complicated. More complex approach are needed. And for the country that have these data gaps, they need to think not as a cost, but as an investment. I remember my work at the French agency dealing with risk assessment, we have a lot of questions coming from the governments. And I can, I promise you that your database will be used daily. All the questions that we receive for risk assessment, first thing that we do is to look at the consumption data. Consumption data, the amount, the frequency, but not only the amount and frequency, but how the food is consumed, how the food is prepared. And I want to say something else is it's not only for chemical hazards. It is useful for microbiological hazards. That's why when you organize those survey, you need to ask a question about the food hygiene, how the food is stored, the temperature of refrigerator, and so on. So altogether, you have a very good database that it will be an investment if you want to embrace the data-driven approach in decision-making about food safety and nutrition. Now, how to start? How to start? This is the difficulty. Yeah. Dietary survey, individual data survey could last 3, 4, 5 years.
To implement.
To implement. No, not only to implement, because when we talk about survey, it's not only the execution. Don't think only about, I will knock the door, hello, I want to participate to the survey, what you ate in last 24 hours. So not only that, because it's very serious stuff. You need to start at the beginning. You need 2 years of planification. How to select the consumer? You need to have your team very good statistician. And you can use some capacity that you have. I'm sure you have in your country, you have the census. And they are professional on that. They are professional how to choose the households and how to reach them. So you, as a food safety authority, usually you don't have this capacity to conduct such complicated and sophisticated survey. So you need to have a partnership with the census service. They are professional for that. Second, you need to, as the presentation we had previously, you need to have the list of the foods. And the list of food is one of very complicated. List of the food, what are the recipes, what are the, you can talk about the composition table. Composition table are useful if the data will be used for nutrient intakes. But the composition is very important because when you have chemical hazards, you can have them not only in, you don't have them in composite foods, but you have them in general in simple foods. So the composition table, in addition to composition table, you need to have the recipes. Second, when you ask the question, what you ate in one day, in 24 hours, you are looking at what they are eating at home and outdoor as well. So you need to have an idea about all the snacks, you have a coffee, you take a cake, a sandwich. So the organization is very complicated. 2 years is the minimum. And you need to have to test your questionnaire, to test your the approach, how to do it. You need a multidisciplinary team. And if I need statistician, epidemiologist, nutritionist, food safety people, database people who know how to organize the data. So this is the preparation. And when you do the execution of the survey, you need to take into account not only the variability between the consumer, but the variability between season. We are not eating the same way in summer or winter. So we need to cover this seasonality variation. You need to cover the weekdays and weekend because our behavior will not be exactly the same. So what we recommend usually is at least 3 24 hours recall. Yeah, 1
during weekend and 2 during weekdays. So I'm not listing all the complication, but I can add in addition to that, children and adults is completely different. And that's why we usually stratify the survey into subpopulation. Children from 3 to 18 years old, and adults, other group. And the questionnaire can be different. And now, how we cover the other segment of age between 0 and 3 years, it is another survey, more complicated. So I think you need to have it as investment, as a work that it can be done in partnership. And when we are dealing with nutrition and food safety and implementation of policy, we say always it is a multi-sectorial approach. And when you succeed to organize such survey, you bring to the table and you bring to the project the different partnerships. So in a way, organizing this type of survey is useful to bring the data, to do the exposure assessment, to estimate the intakes of nutrients, but as well is a very good tool that you start to work together in partnership with the different sector that for health, food safety, food industry, and so on. So it is complicated because we need a lot of resources, a lot of skills, a lot of competency, and in addition to that, the costs. And the cost is very important. I cannot give you an idea about the cost because it will differ from region to region. In Europe, in average, it's more than 2 million euros. So I can imagine in different countries. So it's very expensive, but you have to see it as an investment, and an investment with the different partnership. And you will not do it yearly. When you do one survey, you start to plan for another that will start 10 years after. So each 10 years, we don't need to do it yearly. So it is an investment for 10 years. And imagine 10 years with accurate data that take into account all the variability. And and after that, of course, we cannot capture all the variability. And sometimes, in addition to general population for food consumption, we can have other, what you call them, satellites consumption survey. For example, we did in France one of the survey about high consumer of fish, because majority of them people living at the coast side or fishermen. So you can do something very specific to subpopulation. I think, for example, if you have a concern with some elderly population, you can do something very specific. Pregnant women as well, you can have a specific survey for them. So depending on the context and depending on the public health issue, you can, in addition to the general population survey, target some specific population.